think we in the just before the lunch. Good morning and thank Dr. GVK for the opportunity. Thanks Dr. Periyandavar for the good words. And antipsychotic drugs, what do they do with diabetes? And how do they cause hyperglycemia? We talk about the psychotropic drugs usage in diabetes. These are medications that are used to treat the mental health conditions such as depression, anxiety, bipolar disorder, and schizophrenia. The stress and diabetes, everybody, all the colleagues who come here are already well aware how the stress causes hyperglycemia, and stress makes the diabetes worse in an already existing patient with diabetes. Whenever periods of stress, the sugar goes out of control, and probably once you get relieved of that, the sugar control improves. And this is also interesting to note that the socio-economic costs of what is we know about economy. We talk about the economic burden, diabetes and economic burden, not only the personal level as well as the national level. So the socio-economic cost, what is it? One, the diabetes per se increases the burden on healthcare resources, again puts social problems, again increases the psychosocial burden, and the diabetes increases the risk of developing these select psychotic disorders. It's a huge, huge list, starting from neurocognitive disorders, depressive disorders, anxiety disorders, obsessive compulsive and related disorders, trauma and stressor related disorders, and sexual dysfunction, sleep wake disorder, feeding and eating disorder, and somatic symptom and related disorder. இதெல்லாம் சொல்லும்போது பயமா இருக்கா, நமக்கு டயபெட்டிஸ் வந்துருச்சுன்னா என்ன? So many a time everybody, we are all having some sort of personality issues, some sort of depression, some sort of an anxiety which do not disturb your personal life as well as social life and official work. We are continuing ஒரு border line, எல்லாருமே ஒரு border line ல, the crossing is only a Lakshman Rekha like. So everything within limit is fine. So much of problems in the psychiatric segment can come, and diabetes per se increases the risk of developing this issue. What are the possible mechanisms? The mechanisms remain unclear, but might be multifactorial. The suggested reasons include the drug-induced weight gain and adiposity, development of the metabolic syndrome, antagonism of serotonin receptors, drug-induced leptin resistance, dyslipidemia-mediated pancreatic beta cell damage, and hepatocyte transcription factor dysregulation. These are all the possible mechanisms by which the glycemia gets altered in an unfavorable manner. Again, the patients with schizophrenia are known to be at a higher genetic risk of developing diabetes and cardiovascular disease. The pancreatic insulin secretion is also controlled by dopamine. Dopamine is also some way responsible in the pancreatic insulin secretion, and this may explain why so many antipsychotics cause impaired glucose tolerance. And insulin resistance may occur even in the absence of weight gain. This is a framework for understanding the intersection of mental health and diabetes. And one is the disease acceptance, other one is treatment acceptance, other one is self-management activities. And the stress causes discrimination, again health beliefs, motivation, ascribing meaning. This is on the psychological domain. When you look at the emotional domain, the burden of diabetes causes diabetes distress, fear of hypoglycemia again, psychological insulin resistance, and insulin refusal, and diagnosable psychopathology. Patient himself feels insulin may not work for him, and he will say, already na insulin போட்டேன், எங்கள் ஃபேமிலியில் யாருக்குமே இன்சுலின் சுகர் குறைக்காது. Some sort of rare situation we come across. It's a denial, again coping up with the disease per se, actions, emotions and avoidance, focus coping, and substance use and misuse addictions. These are all. So how does the antipsychotic disorders can affect diabetes adversely? One is very important. One is the treatment non-adherence is a very important factor. which can contribute to the hyperglycemia, again leading on to increased risk of micro and macrovascular complications, and again they can link to the psychiatric disorder. Look at the first generation antipsychotic medications. The prevalence of impaired glucose tolerance seems to be higher with the aliphatic phenothiazines than with the fluphenazine or haloperidol. Hyperglycemia has also been reported with the other first generation antipsychotic drugs such as loxapine, and other data confirm an association with haloperidol also. And some studies have suggested the first generation antipsychotic drugs are no different from the second generations in the propensity to cause diabetes, whereas others suggest a modest but statistically significant excess incidence of diabetes with second generation antipsychotic drugs. These are the second generation antipsychotic drug. Clozapine is strongly linked to hyperglycemia, impaired glucose tolerance, and diabetic ketoacidosis. The risk of diabetes appears to be higher with clozapine than with other second generation or first generation antipsychotic drugs, especially in younger patients. Please understand, the psychiatric illness is becoming more and more rampant in the younger generation. Probably we should thank the IT industry and our working culture, lack of sleep, all these things contribute to that. And many of the diabetes cases occur within the first 6 months of treatment, some within a month and some only after many years. The clozapine appears to increase the plasma levels of insulin in a clozapine level dependent fashion. Again, testing for diabetes is essential given high prevalence of this condition in people receiving clozapine. Again, olanzapine also similar, strongly linked to the glucose intolerance, diabetes and diabetic ketoacidosis, and the impaired glucose tolerance seems to occur even in the absence of obesity and family history of diabetes. Again, there is some case reports of risperidone with IGT, and look at the other second generation antipsychotic drug. The amisulpride appears not to elevate blood plasma glucose. The data of these what's called ariprazole and gipazidone suggests that neither of these drugs alter glucose homeostasis, and data suggests that neither the lurasidone nor arsapenide has any effect on glucose homeostasis. Likewise, early data on brexpiprazole and cariprazine suggest minimal effects on glucose intolerance. And lumateperone appears to have no effect on glucose parameters, but clinical experience with this drug is limited. For patients developing pre-diabetes or diabetes with cardiometabolic risk, antipsychotics such as ariprazole, brexpiprazole, cariprazine, lurasidone or giprazidone has been recommended. Please understand, many things these drugs are safely to be used in a patient expected to for higher risk of developing pre-diabetes or diabetes or already in established diabetes. These drugs, especially when you find a younger individual who is a sedentary, who is a higher BMI, insulin resistance, these are all high risk factors. These are all individuals we can suitably, when they need these drugs can be chosen instead of the other. And this is a choice of antidepressant. Again, all SSRIs are preferred among antidepressants due to their efficacy, lower side effect profile. Among these, fluoxetine, sertraline and escitalopram. Fluoxetine was much better in causing hypoglycemia, weight gain, weight loss, decreased body weight, and better glycemic control compared with the other SSRI. And again, predicting antipsychotic related diabetes. How do we predict? Who all will develop? With all patients who is taking antipsychotic medicine, do they develop diabetes or hyperglycemia? So the risk of diabetes is increased to a much greater extent in younger adults than in the elderly. Patients with first episode of schizophrenia seem particularly prone to the development of diabetes with a variety of antipsychotic medication. Let it be any antipsychotic medication. First episode of schizophrenia, especially in younger individuals, they are at high risk. During treatment, rapid weight gain and increase in the plasma triglyceride seems to be a predictor for the development of diabetes. So when you are long follow-up, you should do this. How do you monitor? Even though there is no clear consensus on diabetes monitoring practice for those receiving the antipsychotic medication, in the UK, NICE guideline recommends for monitoring people with psychotic disorders treated with antipsychotic medication include the measurement of glucose and A1C 3 months after starting treatment and then annually. Frequent monitoring should be determined by physical factors like weight gain and known risk factors like family history of diabetes, lipid abnormalities and smoking status. use of antidepressants. All antidepressants have a favorable outcome on depressive symptoms, which then improve. What are the benefits of using antidepressants? Improves the self-care behavior, resulting in improved glycemic control. All groups of antidepressants can be given safely in diabetes. Both SSRI and buprenorphine improve the depressive symptoms in diabetics. They also stabilize the or lower the glucose levels. Drugs for bipolar disorder in patients with diabetes. 20 to 26% of the people with the bipolar disorder develop diabetes. More commonly due to weight gain, due to psychotropic drugs, obesity and shared genetic risk. Reducing the risk with proper monitoring of lifestyle and modification of psychotropic drugs if possible. And schizophrenia and higher risk of diabetes. The most common risk factors include sedentary lifestyle, nicotine use, increased appetite, and eating high carbohydrate, calorie food, and the metabolic side effect antipsychotic. How do we manage schizophrenia in patients with diabetes? The choice of antipsychotic with a lower propensity for weight gain and metabolic alteration includes the ziprasidone and lurasidone can be used, and you look at the effect on antipsychotic drugs on glucose metabolism on the on glucose metabolism, lipid regulation, dysregulation and weight gain, and the descending order include aripiprazole, risperidone, amisulpride and quetiapine, and ending with haloperidol. These are from the descending order. And the drugs preferably to be avoided are olanzapine, clozapine and serotonin. These drugs can cause weight gain and hyperglycemia. And again, patients with psychiatric disorders such as schizophrenia, depression and bipolar disorders have an increased risk of developing metabolic syndrome in compared with the general population. So the risk of metabolic syndrome, clozapine, quetiapine, olanzapine. The lowest risk is aripiprazole and amisulpride. And again, this weight increase and sedation risk with antipsychotic medication, you can see the upper top one are the least likely, to the red one are the highly likely, and one is on the left hand side the weight increase potential, other one the sedation potential on the other side. And this is again the metabolic profile in terms of weight, glucose, LDL cholesterol and triglyceride. Some drugs do better. So try to choose such drugs, especially when you use the antipsychotic medication. Most often they are required on a long-term basis. Okay, so doctor, the medical healthcare professional, what should we consider? Detailed patient's medical history, personal family history of obesity, diabetes and heart disease, and concurrent medication. Assess whether the patient takes any other medication which can cause weight gain also. The metabolic monitoring protocol during the use of psychotropic medication. The first baseline, the weight, waist circumference, blood pressure, A1C, fasting lipid profile, and family history and personal history. Again, the weight has to be monitored for 3 months. And the 3 months we check everything, and once in 3 months, then annually. This is the suggested follow-up. And the framework of understanding the intersection of mental health and diabetes. And one is the disease acceptance, second one treatment acceptance and self-management activities. The psychological aspects, one is stress causes increase in symptom severity, decline in ability to function, and illness worsens. Again, you look at the social aspects, the burden of mental health condition, impact on social network, social withdrawal, loneliness and isolation, and lack of participation in helpful activities. And what are the biological aspects? Inactivity and role of inflammation, shared genetic risk, lifestyle choices, and lack of access to primary care, possible contribution of psychiatric medication, weight gain associated illness. And shall stop here. Thank you very much. And the last 14 minutes.
Yeah. Thank you.
Thank
you, Dr. Balamurugan, for a nice presentation about these antipsychotic drugs. You have nicely pointed out the relations between hyperglycemia, diabetes, and depression, and the depression producing.
I just would like to welcome everyone for the Cupid conference, which is scheduled on May 10, 11 at Coimbatore. It's the 11th edition, International Conference on Diabetes. Those who want registration can contact me personally, or the organizers, or all the organizers of the 3D conference here. They will be able to help you if you require any registration for the conference. Next one, back next to the track, the first slide, track, initial brochure you put, no? The track, Tamil Nadu RSSDA chapter, state conference, first one, the small slide, first brochure, track 2025. The Research Society for Study of Diabetes in India, Tamil Nadu chapter, is organizing the State Conference on 8th, 9th, 10th of August, and at Coimbatore Hotel Le Meridien. I'm the organizing secretary with Chairman Dr. V. Rajendran. And so for these also, if you require, we are having a separate registration counter. Today and tomorrow alone, we are giving a early bird registration of 1,500 only for these conference delegates. Normal registration goes around 4,000 to 5,000 rupees, and this is an early bird registration for only today and tomorrow. There's a separate counter outside near the registration counter. So I would like to welcome everyone to both the conferences.
Thank you, Bala.